Hey guys, so I kind of just wanted to come on today and give somewhat of a health update of how things have been going as far as starting a new insurance and finding a primary care and rheumatologist and making the choice to go back on medications for rheumatoid arthritis. So I did a lot of research in my area to try to find a good primary care physician who was also an internist so that they would have a little bit more extensive education and experience in dealing with people who have multiple health issues, along with just doing the regular duties of a primary care physician. So I was able to find a female primary care physician that was an internist in my area. It worked out great. The grace of God, I prayed so hard over finding a compassionate and understanding doctor, which is one of the hardest things to do. You know, when I moved across country from California to North Carolina, that was always my biggest fear, because I've had some bad experiences with doctors who dismiss you, who don't listen, who aren't willing to investigate and even just listen to you explain yourself to them and how you respond to pain and symptoms and kind of how your body works. So I'm so blessed and thankful to have found a good doctor. Additionally, I was eventually able to find a rheumatologist in my area, a female rheumatologist as well, which took a very long time. Not only is not only are female rheumatologists rare in this area, it also the ones that we have are in high demand because they're rare. So it took me about 4 months after getting referred to finally get an appointment with this doctor. So I'm very, very, very grateful of that as well, because this would be a very different story if I didn't have a female rheumatologist. So once I got my primary care physician, the first thing we tackled was, we knew the rheumatology referral would take a while because the rheumatologists were going to request my full records from my previous rheumatologist in California, and that was going to take a while. You know, that was about 10 years worth of records almost. So the first thing we did was get me in touch with a GI doctor, a gastroenterologist, because I was diagnosed with Barrett's esophagus in 2018, and my GI doctor at the time said that I should be getting the endoscope every 6 months to monitor the Barrett's esophagus. So shortly after I got that first endoscope, they also diagnosed me with possible, I'm forgetting the name of it, gastroparesis, because when they were doing the endoscope, they saw remaining food from my stomach from the night before, which was over 12 hours, and very little movement in my stomach while they were doing the endoscope. So they also did a gastric emptying study, and that showed slow motility, but not slow enough to be Barrett's esophagus. We eventually learned over time, and now that I've been off of some of the medications for a while, that was actually a side effect of taking oral methotrexate for years. It was mimicking the symptoms of slow gastric emptying. I do have slow gastric emptying. That's just the way my digestive system works and has always worked. And now that I've moved to more of a plant-based diet, it's not as much of a problem. But anytime I do eat meat or certain starches and certain grains, it will kick itself back up. But so I just have to be really careful with things like that. But it was interesting. I mean, the oral methotrexate caused a lot of stomach problems for me. So one of the things I was really worried about when I saw a rheumatologist again was going to be possibly getting re-prescribed methotrexate, because the doctors a lot want to start with that rather than, going straight to the disease modifying medications like the TNF blockers and some of these other, you know, immunosuppressants. So I saw the GI doctor. This doctor was a male doctor, and this is very much part of the reason why I prefer to see female doctors, because in general, in my experience, they seem to have a lot more compassion and understanding, and they know that you know your body and your system, and they listen to you. I saw this GI doctor. He said that they only do the endoscope every 5 years unless the Barrett's esophagus is showing possible, what's the term? Dysplasia. Yeah, so it was Barrett's esophagus with dysplasia. So if there's no dysplasia or, you know, possible signs of like cancerous changes, he said they only do the endoscope every 5 years. That I was a little concerned about that because he asked me, like, do you recall them saying that your results show dysplasia? And I said, I don't remember them using that term or that word or anything like that. So he was like, if there was a dysplasia, we only do it every 5 years. And I was like, I definitely understand the criteria may have changed since, you know, I had that done in 2018. However, I can't imagine my doctor wanted it done every 6 months and you're saying every 5 years. I was just like, I'm confused about why they would want such a frequency and you wouldn't. Like it would just, he couldn't really explain to me why. So I asked him, just to be sure, do you want to request my records from that doctor? I have all their information to see what that previous, you know, biopsy that they did at the time with the endoscope said. So, and he wasn't interested in that at all. He just said he didn't think it was necessary. So I literally had to argue with this doctor for quite a while to just say, just so that we can get a baseline, so that since I am a new patient with you, can we just do it so that we can know everything is fine? I wasn't having any more severe symptoms than I ever had I have really intense acid reflux. So my symptoms were bad, but it was because I hadn't been on the medication, because I didn't have insurance and it was really expensive to buy over the counter. Well, really expensive for someone who had no job or really low income. So it was pretty bad at the time, but I just wanted to be safe because Barrett's esophagus can lead to some pretty serious stuff. So I was like, it'd been 2 years since my last endoscope, and I had no idea how it was doing, and telling me to wait another 3 years to have it again after my doctor was telling me every 6 months just didn't sit right with me. So he agreed to go ahead and schedule the endoscope, and it was just a very odd experience. And I do know that when it comes time for me to do another endoscope, I will most likely seek out a different doctor, only because one of the worst things you can deal with when you're someone who deals with chronic illness is doctors who lack humility and don't admit when they might possibly have been wrong or something like that. So anyway, this doctor, we did the endoscope, and I remember when I was waking up from the sedation from the endoscope, the nurses were saying, oh yeah, so the doctor said like he doesn't see any Barrett's esophagus. She might have been prematurely diagnosed. It looks like it's just really bad acid reflux, but he went ahead and did the biopsy anyway. So I remember I was groggy, but I was trying to ask him, being like, he said no Barrett's esophagus. I don't understand how he could, because it wasn't like my Barrett's esophagus was diagnosed off of a visual. They didn't tell me I had Barrett's esophagus until my biopsy came back weeks later after my endoscope. They just saw some discoloration in my esophagus and said, let's biopsy that to be safe. And then they were like, oh, you actually have Barrett's esophagus. And so it wasn't like they diagnosed off of a visual. They diagnosed off of results from a biopsy. So I thought that was very odd. So when I got home and I finally came to and stuff like that, I was reading his initial notes. You know, it's so great to have like the electronic records that they have now, where the doctor's notes that they put in that day, you get to see right away. So he initially said upon his initial examination, it doesn't look like Barrett's esophagus, but he did do a biopsy in the area where there was inflammation, just to be sure, but it looks like I was prematurely diagnosed with Barrett's esophagus. And then, fast forward to 3 weeks later, when the biopsy comes back, it says I have Barrett's esophagus. And at no point did he comment on that. I just got the pathology results, in my chart system, my electronics records saying Barrett's esophagus, and to follow up, but it was very mild Barrett's esophagus, and to follow up in, for another biopsy in 5 years. So, and I'm totally fine with that. We have a baseline. We know that it hasn't gotten any worse than it was. I don't want to keep getting endoscopes. They're not fun. But at least now I know nothing has progressed. It's not worse. 5 years sounds great to me, but now I know. But at no point did this doctor ever say anything. He didn't comment on the notes. He didn't verify that, oh, it looks like per the biopsy, it was Barrett's esophagus. We'll follow up with the patient or with the results. Nothing. He never called me. He never reached out. Nothing. He just didn't want to comment on the fact that he was wrong and jumped the gun. And I realized that, I've had enough bad experiences where I won't see doctors who have that issue, because I can only imagine, God forbid, I start having other intestinal issues and I try to come to him about it. This is how it's going to be, is him making his assumptions and not listening, to what I have to say. And when he's wrong, also not admitting that or anything. So a lack of humility is something that I just don't have the time and patience for with doctors. So I was really worried about finding a rheumatologist after that happened, because I was like, okay, I've had my first experience. It wasn't a horrible experience, but it could have been worse. If there was actually something truly wrong and I was having symptoms, and was his response. If I hadn't known, my medical terminology and what the previous doctor said and everything, if I was unsure, he would have never done the biopsy and would have said I was misdiagnosed with Barrett's esophagus. This could have gone somewhere totally different, where a diagnosis was removed from my records, and that could have been a problem. So I did eventually get the appointment with my rheumatologist, which was it was probably about a month ago was my first appointment with the rheumatologist. And she was great. She was so understanding. She was patient and compassionate. She listened to everything I said. She had a lot of information to go through. She had all those years worth of tests to look at and everything from my previous doctor. And I remember some of the most impactful things that she said to me in that appointment were, after going over all of my symptoms and how I've been feeling lately, was to turn around from typing on the computer and look at me and say, how have you been surviving all this time without any kind of medical help with your symptoms and your diagnosis? And just to point out that I must be struggling and it must be hard to be living with these symptoms and having, no treatment, really meant a lot to me. It meant a lot that she recognized that I was really pushing and being strong and managing to work and function with such high levels of pain and symptoms and things like that. So that really, really helped me open up to her and give her more information about my life and my choices and things like that. I let her know that, I had switched to a plant-based diet and that I was using things like magnesium, ibuprofen, CBD. I use topical CBD products mainly, and just in environmental changes, doing, adapting my environment to help with my symptoms as much as possible. The type of bed I have, the type of recliner I sit in, how I work, what kind of desk and chair I'm using, just all of those things, just making my environment as stress-free as possible, controlling the temperatures that I'm exposed to, all those kind of things. And it was really nice to have her truly listen and understand what I was saying, and not that none of that matter, because there can be some doctors out there who are just like, yeah, when you give them that kind of information, they're not truly listening and And because hearing that from some patients can be helpful for their other patients, you know, to make some of those suggestions. You know, I have other patients who've tried this, and that seems to help. So once I told her all the things that I was doing, she was like, okay, so I see that you know, the last about year or two of you being on your biologic medications, you were no longer testing positive for RA. Now, I initially tested positive for RA, which is how I got my RA and fibromyalgia diagnosis in the first place. I was having symptoms. My primary care, because I was having joint pains and joint symptoms, happened to just run the RA test just to see, and I tested positive, and I had a high rheumatoid factor at that time, and that's when I initially got, you know, sent to a rheumatologist. I felt very fortunate that I actually tested positive, because a lot of people who have the symptoms don't test positive, and so it takes them a long time to get the diagnosis, but I got it right away because the tests were very typical. And so, but after taking all of the biological medications that I was taking for all those years, my tests were starting to come back negative. Even though my tests were coming back negative, I was still very symptomatic. But we couldn't really tell how much was fibromyalgia and how much was rheumatoid arthritis. So I was diagnosed as in remission with rheumatoid arthritis since I was no longer testing positive. When I was initially diagnosed, I did a test called the Vectra test, which is a test that specifically tests the disease activity level for rheumatoid arthritis and inflammation in the body. And at that time, it said that it was moderate, and my doctor considered the numbers, you know, on the higher end, which is why once she did that test, she started me on the biologic medication. I had never had that test done again. So that test was probably done when I was like 29 years old. This is now 10 years later, or 11 years later. And I haven't had the test done again. So my new rheumatologist that I just saw was like, let's go ahead and run the typical RA panels and see where your blood work is. You haven't had your blood work done in years. She was like, let's see where that shows. But she's like, I would also very much like to do the Vectra test. One of the great things is now the Vectra test is covered by insurance. Back when I did it 11 years ago, it wasn't covered. I actually paid out of pocket for that, but it was worth it because it was really helpful to know what the disease activity levels were, and not just what like a simple RA test says, because unfortunately the way RA tests are run now. So let me go back. So she ran all the tests. These were all tests that take about 2 to 3 weeks to come back. So none of them were like those same day tests that you get the next day. So when the test came back, I was actually surprised after this many years without being on the medication that I still tested negative for RAs with the regular RA test. But at that same time, I was so grateful that this doctor did the Vectra test as well, because I can imagine what could have happened if I saw a doctor who only did the basic RA test and saw that I tested negative, even though they had my record saying that I tested positive initially. And I tested positive for like 2 years. It wasn't like I tested positive in one test. I tested positive for 2 years. But it would be very possible that I could have had a doctor who decided to see those negative regular RA tests and then tell me I was misdiagnosed and remove the RA diagnosis. That could have been what happened. And that was very scary. It was very scary because when I initially did my test, there was one RA test, just one. Now there's like a panel of tests they do for RA, and they all showed up negative. The odd thing about the way they do these tests now is my initial test, they just tested the RA factor in general, and it gave you a number, whether it was 0 to whatever number. Now you just get this thing that says you were less than 20 or less than whatever the number is, but it doesn't give you the number anymore. So it doesn't even tell you if you were like 19, just one number away from whatever they're considering is positive RA. So, and that's why my doctor was like, I don't just go off those tests, because these tests don't even give you all the information you could need it doesn't tell us what the numbers are if they're less than what is considered at this time positive RA. And these kind of the way these tests are done and what the numbers mean is changed so often that having tests that just show up that way, that are just like they were over this or under this and not giving exact numbers, can make it hard to know really what's going on. So all of the regular, I think it's like 4 or 5 RA specific tests that they did, all came back. They were less than whatever the number is that they would consider, someone who has RA. However, she did the Vectra test, and my numbers for that Vectra test are now higher than they were when I was diagnosed 11 years ago. And she was, she wasn't shocked, because she was like, you haven't been on medication for so long, I would expect it to be pretty active in your system. But she was just shocked that like the number wasn't at least the same, but that it had gotten higher. So, she called me about a day or so after the test results came in so we can go over them. And she was just like, I'm so happy we did that Vectra test, because the Vectra test tells, it's a lot of tests combined in one, and it tells you so much information about your inflammation levels, your CRP rates. Like, it gives a lot of information, and the inflammation in my body was through the roof. And there were all of these alerts in that test saying that I needed to get on disease modifying medication as soon as possible to avoid any further joint erosion, and that it would, like, this test gives you an estimate of how much more time you can be this high of a level of activity before permanent joint damage starts taking place. And that's always been the goal, is to avoid permanent joint damage. Now, I'm going to be honest with you. I even had this conversation with my doctor before we did the tests. I said, I have had times where I'm like, don't even take the medication and let the permanent joint damage happen. Because at least if you have this visual of permanent joint damage, that more doctors will take you seriously with your level of pain. But when they don't see permanent joint damage visually, when they look at your body or in your x-rays, they don't, non-rheumatological doctors who aren't rheumatologists, they don't understand that you can be in just as much pain even though the changes hasn't happened, because the inflammation in the synovial fluid and the joints and the sacs around your joints is so severe and causes so much pain and stiffness that even without those visual changes, the pain, it can be very debilitating still. And so the whole point of, early diagnosis and early treatment is to stop permanent damage. But a lot of doctors just don't see that you actually have a problem until the permanent damage is there, and they can't truly appreciate and want to stop the permanent damage from happening in the first place. But luckily I've had good enough doctors who, that is our goal, is aggressive treatment to stop the joint damage before it happens, because once it happens, it's not reversible. The only thing you can do is surgery to try to get better function of your joints again. So we're trying to stop the permanent damage. I do have a series of x-rays I need to get done from my rheumatologist to see, especially because the arthritis has spread to my feet, and it's worse in my feet now than it was in my hands. And I think that's mainly because you can't rest your feet. You can't not use your feet, so it just was getting a lot worse. So, so we got those results back. It said that it was no longer moderate. It was high, and severe and high was the results. So, she called me and said, if you're comfortable with it, she's like, obviously she's like, you don't have to take medication, you don't have to be on anything, but if we want to avoid permanent damage, then we should go on disease modifying medication as soon as possible. So we talked, and she, the normal first step would be, she wanted me to start on methotrexate. We wanted to try a medication to help with pain management, but I wasn't willing to do any actual pain medications because of the addictive tendencies and the inability to function without them. Like I'll link my previous video where I talk about, dealing with this stuff without pain medication. I didn't want to lose all of the progress I've gotten over these years of learning how to manage life with this level of pain. So we did start me on a mild muscle relaxer. I'll enter the name up here because I can't think of it at the moment. And I just take that probably if not every day, every other day at night before bed to help with the pain so that I can try to sleep better, because I only average about 4 to 5 hours of sleep a night due to pain. So we just wanted to see if we can get, if I can start feeling a little bit better, a little bit more energy, a little bit healthier, if I could just get the pain a little more under control overnight. So we did start on that before we even got the results back, to try to help with some pain management, and that has actually been very helpful. The medication doesn't linger in my system. It doesn't, because I'm taking it at night, the grogginess that it causes helps me sleep, and then I wake up with a little bit less pain, and that's been very helpful, and I don't have any side effects from it, so that's great. However, once we got these results back, she, the first thought was, let's try starting on methotrexate. I told her I truly, truly dreaded starting back on methotrexate because of the side effects and symptoms of methotrexate. If you've ever taken it before, the level of nausea and how sick that medication makes you feel is ridiculous. Like, just the thought that I've managed to learn to function and live better with these symptoms, and to know that I was going to take a medication that was going to increase other symptoms and make me feel bad in another way, I started having anxiety nightmares about taking that medication again. And now we did talk about starting me on the injectable methotrexate rather than the pills, because of all the stomach issues that I had from taking the pills. But I knew that even on the injection, I was going to have, methotrexate is a medication you would take once a week, and, it adds to the fatigue. It still would cause nausea. I know it would still cause nausea, just wouldn't be as severe, but the nausea and just a general feeling of being unwell and feeling very sick. It is like a very mild form of a chemo medication. So it just makes you feel really crappy. Like that's like seared in my brain of remembering the once a week taking it, and for 2 or 3 days after I take it every time, of just feeling very, very sick, just feeling sick in general, and trying to rationalize in your head, like, the feeling of poisoning yourself on a regular basis. It was really, I knew I was going to struggle to make myself take it. And just the thought of something that I don't know or ever recall feeling any positive side of methotrexate, only the negative, because the negative was so bad. I'm sure it was helping the RA not be as severe, but the negative was so strong that I just couldn't bring myself. But I was thinking when she was talking to me that I truly had no other choice. So I was kind of just trying to psych myself like up for it, get myself ready for feeling horrible half of the week, but she let me know that that's not really the protocol anymore, that you don't have to take methotrexate, that you can just try taking the disease modifying medications, the TNF blockers, things like that. So I was a lot more interested in that. I was like, that might be a lot easier to handle than to try taking methotrexate. She was like, now I can't promise you that the methotrexate, I won't suggest it again in the future if this medication doesn't work, or doesn't work as well, or stops working or anything like that. The methotrexate may still need to be added, but we'll definitely save that as a last resort. So she had a great idea. She wanted me to try a medication that I've never tried before. So when I was diagnosed, because the disease level was so high, my doctor didn't even try any of the pill versions of these disease modifying medications. I don't know how many existed out at that time, but I know one of the most popular ones was, I can't remember right now what it's called, but I'll go ahead and like type it here up on the screen. But that's what I expect. It's Xeljanz. Xeljanz is the name of the medication that I know that usually when people get diagnosed, that's the first medication their doctor tries. Before they go all the way to needles and stuff like that, they'll try Xeljanz, which is, I think, a once a day medication that is very similar to the injectables, but just works a little bit different in the body. So that's what I thought she was going to prescribe me. So because she asked me if I'd taken Xeljanz, or there was some other one that she named before, and I hadn't tried that. So she thought that would be a good idea for us to try a pill version first, just because I'm reintroducing these type of medications to my system. And with, us being in a global pandemic, the least harsh the medication and the least effect it's going to have on my immune system, the better. So that if I do contract, you know, anything going around right now, that I still have a fighting chance of fighting it. So she suggested a medication called Renvok, and I'll put it up on the screen here as well. And this is a daily pill. And she thought this would be a good idea because one of the issues that I had with my previous medications is that they would work for a while, but then my body would adjust to it very quickly. And then it would just, every month that passed, it would help a little less and a little less. Also, I would feel great for that first week or first couple of days of the injection. And then I would feel bad too soon before it was time for the next injection. But none of those medications, you just can't take the injections more than, I think like it was, Embro was weekly, but every other one I took after that, I tried Humira, Actimbra, Symphony Aria, which is the infusion, and there was another one that I tried. I think I was saying before, there was Orencia and Orencia and Actimbra were the other ones I tried as well. So, and then the last one I did was Cimzia, which was that one worked. It worked great. It was extremely expensive, but my body was slowly starting to adjust to it because I was on it for, I think, about two and a half years or something like that. But anyway, she thought that it would be a good idea to try the Renvok because it's a daily pill. And she was like, that might be very helpful for you to have something that you literally take every day instead of something that is every 2 weeks. She's like, it might help the symptoms. So starting last Friday, I started on the Renvok. So it's only been, it's not even been a week yet. So don't completely know how well it's going to help. However, I don't have any side effects, and that's what's positive. With any medication like this, I always take these medications at night so that any fatigue or nausea that the medications may cause, I can just usually sleep through it. I was taught that by my previous rheumatologist. Even when I took methotrexate, I would take, I think it was a dose of either 6 to 8 pills once a week. So I would take 3. She taught me to take 3 before bed and the other 3 in the morning to kind of space it out. And so it helps reduce the side effects. So I started taking Renvok. I was able to get it through the medications like this have to be prescribed through a specialty pharmacy. They don't get prescribed through like your regular Walgreens or whatever. So this was such a quick process. I was surprised. She put in the referral for the medication. And then the referral went through like a week and a half later, and then the specialty pharmacy called me like the next day, and then the medication was delivered the next day. And it was really quick that it all happened. And thankfully this medication does have, which most of these medications do, have a copay assist program. And so I'm able to get this medication for just $5 a month, which is very helpful because without the copay assist program, it would have been $50 a month, which I can't afford. So I'm very, very grateful that it's only $5 a month. So, fingers crossed and prayers going that this medication is going to start reducing the inflammation in my body and help me feel a lot better. And also I'm praying that if it does help, that it continues to help, because my body tends to adjust to medications quickly and it stopped working. But I would love to hear from any of you who've tried Renvok before. I know Renvok is a newer medication. I think it's only 1 or 2 years old, maybe 3 years at the most. But when I first was diagnosed, this medication wasn't an option. But I hear that it gets prescribed for eczema and psoriasis and a lot of other autoimmune issues, and it's really helpful. Like I said, I'm so grateful. So far, I have 0 side effects from the medication, like whatsoever, which is great. This medication, you do have to be a bit more careful on. I think it's higher risk of complications with any kind of heart disease or blood clots and things like that. And my doctor thinks that's maybe why my doctor wasn't, too eager to push something like that, because it just heightens the possibility of all kinds of other symptoms. But from the research they've done in between when I first was diagnosed and now, she doesn't think that, I'm at high risk for those things. I don't have any blood clot issues. I don't have any heart conditions, anything like that. So we don't think that that'll be an issue. But like with any of these medications, I'm gonna have to do extensive blood work every 3 months to check, all organ functionality and make sure that everything my system is handling the medication well. So yeah, so like I was saying, I would love to hear from any of you guys who tried Rinvoq before, or and what other RA treatment you guys have tried. I've been out of the loop of knowing what RA medications are out there right now for the past 3 years. I haven't 3 or 4 years it's been since I've had any knowledge or research anything about it, but so far so good. I'm really hoping and praying that this medication can help make a major change in my life to give me a higher quality of life, hopefully to help me also not need many other medications as well. So yeah, that's what's been happening. This is a positive thing. This is, a good outlook. I'm very hopeful for some change, and I hope that, that no side effects develop, and that, it'll lower the pain level and the inflammation level, and, that'll show in the lab results as well. And I'm so grateful for you all who are watching and being a part of this journey with me, and, are sharing your experiences. And I'll talk to you soon. Bye.